this is my patient, and I am just scanning the room. I'm at the CMC lab. I will not be using that stuff. And this is my work area to just take notes and my supplies. And we're gonna get started. So, I think hopefully that's within the field.
Yeah. I did see in the mirror. It showed me.
Thank you. So my name's Heather. I'll be your nurse today. We're gonna do a head-to-toe assessment, if that's okay with you.
Okay, that's why I'm here.
Okay.
Heather, nice to meet you.
You too.
I'm Jeffrey, your patient.
Great, thank you. Okay, I'm gonna just wash my hands. Okay, Jeffrey, can you tell me where we're at?
We are at the CMC school laboratory.
Okay.
Nurse lab.
And can you tell me what day it is?
Today is December 5th, I believe, 4th. December 4th at 12:15.
Okay. And can you state your name and date of birth?
Jeffrey B. Campbell, 11/7/1971.
Okay. So the patient appears to be oriented to person, place, and time. The patient appears their stated age. The patient has a expected mood and a pleasant affect. So we're just gonna get started with a hair assessment and skull assessment. That's okay.
Okay.
Okay. So I'm just assessing the head for any lumps or abnormalities. The hair appears nice and evenly distributed across the scalp in a normal male pattern. Appears to be appropriate color for his age, though a little on the gray side. The head appears normocephalic and symmetric. No lumps or lesions. And we'll start with we'll go ahead and test your eyes now. So we'll just have you follow this light with your eyes. Don't move your head. So we're testing the 6 cardinal fields of gaze. Okay, so you passed that. I'm just gonna come in from the side to assess your pupillary reflex. So just look straight ahead. Okay. Pupils are equal in size, symmetrical. Eyes appear symmetrical, appropriately reactive to light, and constricted with the pin light. The iris appears bluish green, symmetrical, clear, moist.
I do wear contacts.
The patient does wear contacts, which he has in today. The eyebrows appear symmetrical. Any tenderness here in the frontal and maxillary sinuses are non-tender to palpation bilaterally. So back to the eyes, I'm just gonna get some gloves. I do have to touch your eyeball. Okay, so I'm just gonna pull down on your lower lid. The conjunctiva appears pink, moist, no drainage, no puffiness. The eyelashes are appropriately dispersed along the lash lines, upper and lower bilaterally. No crusting or drainage or edema around the periorbital area. The sclera appears to be white, no signs of jaundice or redness. The sclera appears moist and symmetrical. I'm just gonna palpate your eyeball. Sorry. Okay, so the eyeballs are firm. No tenderness with that.
No.
Okay. Then we'll go ahead and have you, we'll do the Snellen eye chart. So I'll have you cover one eye and read the lowest line that you can see, covering your left eye first.
I do have two different contact strengths. One is for far and one is for near. So this is my far, and the lowest line is DEFPGTEC.
Okay, so that was line number 8. Can you read line 7?
7 is FELOPZD.
Okay, and then do read the lowest line you can see with covering your right eye.
E, FPTOZ, and it gets too blurry.
Okay, read whichever line you can see.
TOZ.
Okay. So the left eye is line 3 is what he could read, and then line 7 for the right eye. And I have a small writing. Can you read any of the writing on that?
I can read 0.9% sodium chloride, injection USP, and then each 50 milliliter contains 500 or 450 milligrams sodium and chloride.
Great. So the presbyopia is corrected with his contact lenses. Otherwise, he would read with reading glasses. Okay. All right. And so we'll just start with the ears. I'm just gonna palpate the ears here. Let me know if you feel any tenderness. So the helix, the tragus, the lobus. The ears appear clean, pink, symmetrical, warm. Any tenderness when I feel those? Okay. then we'll go ahead and look with our otoscope. Just gonna grab a tip. Okay, so I'm just going to pull your ear up and back. No. It's the battery. The light does not appear to be, oh, there it goes. Okay, pinna up and back. Just going to gently insert. Okay, some cerumen, some hair. You see the tympanic membrane. It is pearly gray and is intact. So we'll do the same thing on the other side. Pull the pinna up and back. Tympanic membrane is visible, pearly gray, and intact. Okay, so we're good there. I don't know how to turn this off.
Maybe twist it, the top. Maybe the top, yeah.
Oh, okay. Okay. So hearing, I'm just gonna stand behind you and have you repeat back the words that I say.
Alone, cat, dog.
Okay. And we'll do the other side.
Couch, bed, table.
Okay, good. Hearing is equal and appropriate in both ears. And then we'll go ahead with our tuning fork. So I'm just gonna have you tell me what you hear when I tap this and place it on your forehead.
Nothing. Maybe a very faint hum.
Do you hear it in one side or both?
Both.
Okay. Equally?
Yes.
Okay. So I'll do the same thing and I'll just put it on the tympanic or the maxillary bone there. Tell me when you stop hearing.
Probably about now.
Okay.
Yes,
Now
I
tell
hear
me
it.
when you stop hearing that.
Now.
Okay, so 20 seconds and then about 20 seconds longer that was for the rind test. And we'll do the same thing on the other side. And the Weber test was the one we did on the top of the head, which he passed. Okay. you stop hearing?
No.
No, tell me when you stop hearing that.
No.
Okay. So the on-bone conduction for the left side was 20 seconds on the mastoid process, and then about 40 seconds for the hearing in front of the ear. Okay, so that was great. You passed. Appears to have stronger hearing on the left side. Okay, so I'm just gonna palpate your temporal arteries. And they're +2 bilaterally. So I'm just going to feel your TMJ joint. So open and close your jaw. Okay, no clicks or crunching. It's smooth. So try to open your jaw against the resistance of my hand. Okay, great. And so then we're gonna have you smile, show your teeth. Okay. I'm gonna just don some new gloves for the mouth inspection. And just going to sanitize. Okay. Any sores in the mouth? Any pain? Any tooth pain?
No.
Okay. Put my tongue blade. Okay. So I'm just gonna observe your cheeks. And they're moist, pink, no sores, lesions. Teeth appear intact, straight, no teeth missing or chipped. And say ah. Okay. So the uvula rises appropriately to phonation. And just stick out your tongue for me. Okay, so the tongue appears pink, no turr, no redness, no swelling, and then I'll have you lift it up like that. Okay. Yep, looks pink, moist, venous, bilaterally, no swelling. I'm just gonna inspect your gums. So the gums are intact, pink, no bleeding, no discharge, no swelling, and the lips appear symmetric, and And so then we'll look at your nose. So the nose is symmetric, and any pain or tenderness
No.
around the nose. Okay, I'm just gonna have you tilt your head back a little bit for me, and I'm just gonna use my light inside your nostril. Okay, the nasal cavity appears pink, patent, no discharge. Septum appears midline, maybe a slight deviation to the right. Okay, looks good. Okay, so I'll have you occlude one nostril and breathe in. And then do the same thing on the other side. Perfect. So no difficulty with either NUR breathing, no obstructions there. So then I'm just gonna palpate your carotid artery. Okay. Carotid artery is +2 bilaterally. And then I'm going to assess for your cervical lymph nodes. Let me know if you feel any pain or tenderness. Any pain or tenderness with that?
No.
Okay, so the cervical lymph nodes are non-palpable, non-tender to palpation bilaterally. So for the cranial nerve 11, I'll have you turn your head side to side. Okay. And then up and down. Okay. And then shrug your shoulders against my resistance. Okay, great. Okay. And then I'm going to test cranial nerve 1 with a, I'll have you close your eyes and tell me what you smell.
Coffee.
Okay, so I have coffee beans here. So cranial nerve 1 is intact. We already tested cranial nerve 2 with the eye chart. I'm just gonna dim the lights now for the retinal assessment, and we'll use the ophthalmoscope for that, and I will test your corneal light reflex at that time, so just stay there. Okay, so I'll start with your corneal reflex, and so that is present symmetrically on bilateral eyes. That was the corneal light reflex. And then we will use the ophthalmoscope. Okay. Not sure it looks. sure how to, I'm just gonna turn the light back on. So if I were to assess the retina, I would use this, and I would hold the patient's head and look into their pupil. I cannot visualize the retina or the optic disc. Okay, I'm gonna try that one more time. Yeah, I cannot visualize the retina or the optic disc. Okay. That's okay. We're gonna just move on. Okay, so the thyroid would be here. It's non-palpable, non-tender, right?
Mm-hmm.
The trachea appears midline. Okay, so then we'll just move on to the upper extremities. So we'll do some range of motion. I'll just have you do your arms in a circle. Okay. And can you flex your wrists and pronate them? Okay. So patient has 100% full range of motion on the upper extremities. I'm just gonna take a look at your hands. Okay. So hands are warm, pink, appropriate skin color for his ethnicity. Cap refill is less than 2 seconds. And that is bilaterally. Hands appear adequate size for his frame. They are symmetric bilaterally. And I'm just going to palpate your radial pulses, which are +2 bilaterally. And you can just rest your arms. So then I'll just palpate your brachial pulse. Brachial pulses are +2 bilaterally. Okay, so I'm just gonna assess your chest now. The chest appears symmetrical, no barrel chested features, appropriate size and diameter. And now we're gonna move on to the lung sounds. So I'm just gonna have you take deep breaths and I'll go from side to side. So go ahead. Lung sounds clear in all lobes, bilaterally on the posterior. So I'll have you take deep breaths again. Okay. So lung sounds are clear in all lobes, anterior and posteriorly, and bilaterally. So we'll listen to your heart sounds now. So this is the aortic. Okay, normal sinus rhythm. Good strong heartbeat. This is the mitral valve. Normal sinus rhythm. Okay, so I'm just gonna listen to the apical pulse for 1 full minute. Okay, so apical pulse is around 68 beats per minute. No murmurs or swishes. It was a normal sinus rhythm. So we'll go ahead and have you lay on your back for the abdominal assessment. And yeah, I can take off your shoes. Okay, any bowel or bladder issues? Any stomach issues?
Not currently.
No, okay. So I'm just gonna lift up your shirt and inspect. And so the skin appears warm, pink, normal skin color for his ethnicity. So we're just gonna go ahead and give a listen to the 4 quadrants, starting with the right lower. Let's see here. We're gonna go clockwise. Okay, bell sounds heard in all 4 quadrants. I'm just gonna palpate your abdomen. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay, so no pain or tenderness found upon light palpation. Now, next we're gonna go a little bit deeper, so about 4 or 5 centimeters. So let me know if you feel any pain or tenderness. Okay, so no pain or tenderness upon deep palpation, no masses or lumps. The abdomen is soft. And so now we're going to listen to your arteries. So first the aortic artery. Okay, and then +2. Then we'll listen to the renal arteries. Okay, I couldn't really hear anything on the renal arteries, but if I were assessing them, this is where I would do it. And then I would assess the iliac arteries. And again, I don't really hear anything upon assessment of the iliac arteries, but this is where I would. So next, if I were to assess the femoral arteries, it would be closer to the groin area, but we are going to skip that for this video, but they are located just below the belt line. Okay, so you can go ahead and sit up. Thank you. So we'll do some range of motion for the lower extremities. So go ahead and do a circle with your legs each side. Good. Good. And can you flex each leg out straight? Good. Good. And can you pronate and supinate your ankles? Great. All right. So I will have you take your socks off for the next part. I'm just gonna grab some more gloves. Perfect. Okay. Before I forget, I'm gonna have you do some more facial assessments for cranial nerve 7. So can you frown. Puff out your cheeks. Smile big. Puff out your cheeks again. Okay, so cranial nerve 7 is intact. I'm just gonna test your, have you close your eyes and tell me where you feel the cotton ball.
Above my left eyelash, or eyebrow, excuse me.
Okay. And
on my right upper cheek.
okay.
My lower right jaw.
Okay. So cranial nerve 5 for the trigeminal is intact. I'll go ahead and let you keep your eyes closed. So tell me if you feel anything sharp or dull.
Just a little push on my left
Just sharp or
bicep.
dull?
Dull.
Okay. We'll try that again.
My left bicep a little sharp.
Okay. And what about now?
Very soft on my right bicep.
Okay.
Or dull, excuse me.
So with 2 seconds in between. Okay, tell me if you feel anything sharp or dull.
Sharp on the left hand.
Okay.
Soft on the right hand.
Okay.
Very soft on my left leg, femur. A little sharp on the right upper knee.
Okay. Great. So that was a pain assessment, passed. So we will do some strength tests on the upper and lower extremities. So I'll have you grab my hands, just grab my hands as tight as you can. Okay. And so put your arms out and don't let me push them down. Great. Okay. Now don't let me push them up. Good. So 5 out of 5, full strength on the upper extremities. And then for the lower extremities, don't let me push down your legs. So try to raise up, so don't let me push them down. Okay. And then don't let me pull your legs. Great. Great. And then, so 5 out of 5 strength on the lower extremities. So I'm just gonna take a look at your lower extremities. You can just relax your legs. Some slight edema noted on the right lower extremity. Normal, no edema noted on the left lower extremity. Hair distribution is adequate and symmetrical. Some hair loss noted at the very distal part of the lower legs bilaterally. And so I'm just gonna look between your toes. Okay, some maceration noted between toe 3 and 4, as well as between toe 2 and 3 on the left foot. And skin is clean, intact, and dry on the right foot. And so we'll go ahead and do some reflex tests now. So I'll start with you. I'm just gonna have you hold your hand out. So just have your feet flat on the ground. And I'm just gonna test your, so just relax your arm. And this is the brachial reflex. Okay, we'll do that on the, that was the radial reflex, the brachial. Okay. We'll do the same thing on the other arm, just relax your arm. Okay, reflex positive. And then, okay, no reflexes on the brachial deep tendons. So then I'll have you do one arm like that and just relax your arm. Okay, positive tricep reflex on the right. Great, positive tricep reflex on the left. Do the same thing on your quads. So maybe scoot back a tiny bit. Okay, so okay. Positive deep tendon reflexes bilaterally on the quadriceps. We'll do that same thing on each Achilles. So just relax your lower legs. Sorry. Okay. Yeah. Sorry. Not really sure if that was a positive Achilles reflex bilaterally. So then I will have you just give me this foot. I'm just gonna drag this across your foot. Okay, the positive plantar reflex.
It tickled.
Yeah. So positive plantar reflex on the bilateral feet. So that was the curling of the toes with the stimulation of this tool. Okay, so then I'll have you stand. And I'll have you just close your eyes and I'll just check your balance. So don't let me push you. All right. Balance appears to be intact. Now you can sit back down. No swing, no change in gait. And I think that is